one thing I want to stress is the real problem here has nothing to do with any difficulties with reaching people who have a history of mental illness. The problem is that for some reason, these communities have not really tried to connect before, and people are afraid to engage them. So our philosophy is not that we need to create some kind of special new training in order to reach people with mental illness, but it's just that, if we bridge this gap and start introducing mediation to them, we'll be able to really get some pretty cool places. So I actually first started doing this work in July. I was at a peer specialist conference in New York City, and I presented this workshop, just explaining what mediation was and why I thought it could be helpful in these settings to the peers. And everyone was really excited about it, and they're ready for it. So it's really a matter of just being sensitive to what it means to be part of a mental health community, so that way you don't offend someone, and go in there and actually give them the trainings. So we want to get better at it. We want to improve our proficiency, but we also don't feel like it's such a new idea to deliver a mediation workshop and mediation training. What's new is delivering it to these stakeholders. I think Stephen Goldman have a question. I know his hand went down after I mentioned it, so maybe he didn't.
Well, I do have some other questions here as well. One from Heather Martin asks, what mediation model will you be using for the peer mediator training? Is there a specific model?
So we're not really teaching mediation to such an extent that we would ingrain someone into one model over another in these first workshops. However, it's going to